You had a very interesting presentation yesterday, and we would like you to tell us a few things about it.
Oh yes, I talk about how to put a valve within a degenerated surgical valve. We know that more and more the surgeon put when there is a disease in a valve, a biological valve, because you don't need anticoagulation, you don't have this sound of a mechanical valve. So more and more biological valves are put inside the heart. But these valves, they don't last forever. They have after 10, 15 years, maybe 18 years sometimes, they can have problem of degeneration because they are tissue, biological tissue, either because of calcification or because of fibrosis or because of infection. And then you are dealing with the patient that have to be submitted to a further operation, to a second operation. So instead of having a second operation, we are putting a valve transfemorally, patient awake in the usual way in which we put a TAVI, within the previous surgical valve. And we do that knowing the dimension of the previous surgical valve, the annulus dimension. We do it also knowing which kind of size of eight the previous valve have. So we choose our dimension of our valve and we put it inside, and the valve is held by the annulus of the previous valve and start working very, very well. Of course, with this procedure, we have to pay some attention to some detail, which are, for example, the ostium of the coronary artery that are positioned just behind the previous valve. So we have to pay attention not to close the ostium of the coronary, because it can be a disaster. We have to pay attention to the eighth in which we implanted the valve. But overall, I think this is becoming the treatment of choice for degenerated biological surgical valves.